Hello and welcome to All Things Women's Health. I'm your host, Dr. Chris Stroud. I'm an obstetrician gynecologist of some 30 years. I'm a husband, I'm a father, I'm a grandfather, I'm a small business owner, I'm a Catholic, I'm a lot of things. But right now, in this moment, I'm your host as we talk about really all things women's health. And it doesn't matter if it's infertility to childbirth, menstrual issues to menopause, miscarriage to mammograms. If it affects women and their health, it's on our agenda, and always from an authentically Christian Catholic perspective. And our agenda today includes a journey, a story of a journey, of a delightful couple that I know you're going to find inspiring. Brittany and her husband, Joel, I've known for quite some time, and I've had the pleasure of participating in their care. And they're going to share with us the highs and the lows of their journey, how they got through the tough times, and lessons learned along the way. So Brittany and Joel, welcome to the show.
Thank you.
Yeah, I appreciate you coming out, taking the time to share your journey. I know your journey, and I know that listeners and viewers are going to really enjoy it. The first thing that comes to mind that I'll bet our viewers are wondering is, why in the world would you be willing to tell your story? And don't say that I talked you into it. But you know, as you were talking about this, what made you say to yourself, I think I'll tell my story?
Honestly, it's a really easy thing for me to do. Our first pregnancy ended in a miscarriage. And about a year and a half after that, we'd already had our son, but a year and a half after the miscarriage, I started kind of my own ministry online with an Etsy shop to encourage moms who have had miscarriage and celebrate rainbow babies.
So the idea of telling, helping through telling, that's not foreign to you.
Not at all.
Yeah, good. Yeah. Well, let's start, I guess, at the beginning. You've alluded already to part of your story.
Yeah.
Maybe we should back up a little and start towards the beginning of this timeline.
Yeah. We got married in 2013, and in 2015, we decided we would try to start trying. In January of 16, I found out I was pregnant, and then in February, I had a miscarriage.
Yeah.
Got pregnant again in October of that year, and we had our son in May. He was a very hard baby.
Very.
And so
now that second pregnancy, is there anything unusual or noteworthy?
It was perfect.
Yeah.
Like, I had very minimal nausea 1 week in the first trimester, but everything else was pretty much like textbook perfect.
So you went quickly from the pain and frustration of a miscarriage, the doubts, all of that goes right into pregnancy that ended well. Joel, do you remember the two of you talking after the miscarriage? Should we try again? When should we try again? What were those conversations like?
Yeah, I think, for me, I was scared to try again. What if this happens again?
Yeah. I think that
was scary.
I think that's a common response. And it's funny how the two men end up sitting here, I guess, like this. But, we're sort of wired to protect. And a lot of times the protection instinct says, well, this is easy. Just don't do it again.
Yeah.
Yeah, you can't get hurt if you don't do it again.
Right.
It doesn't work so well, but it's a logical idea. But you clearly got over that.
Yeah.
And then you decide we're doing this again, and we're successful.
So probably
you were more convinced, I feel like,
than
I was.
Yeah. I knew that another baby wasn't going to fix everything, but I very much wanted to be pregnant again. Yeah. So I was ready, let's start right now.
Yeah, I find when that desire is written on someone's heart, it's powerful. Get out of the way.
Yeah.
So you had your son, uneventful pregnancy.
Yeah, pretty much. At 37 weeks probably, my blood pressure started to rise, and so they were watching it. And there was one night that it got really high. I don't remember what it was, but it was higher than I didn't even know it could go. Yeah. He was outside working, and so I thought, okay, I'm going to sit on the couch for 30 minutes, and then I'll take it again. And it just went up, and I was like, okay, we need to go to the hospital.
It was the night before.
Yeah, and so we got to the hospital, and then it was down, and everything was fine. They monitored me for a few hours, sent me home, and within an hour of being home, I went into labor. So, we did the waiting at home and got to the hospital, and I think I was 4 or 5 centimeters, so they admitted me, and and then I had him within 6 hours probably.
Yeah.
I had a 3rd-degree tear with him, but otherwise, I mean, everything was great.
Yeah. So viewers would probably identify with that's a pretty normal,
Yes.
a normal part of
Yes.
most stories.
Yeah.
And then keep going.
Yeah. Well, I will say he was a very hard baby. We had a great pregnancy.
Yeah, you didn't mean
and
hard
a
delivery.
very hard baby.
Hard baby.
And so we waited 4.5 years.
Oh, he was hard. Yeah.
Yeah.
Yes.
mhm.
Yes.
We almost didn't have our daughter. And then,
So let's pause
Yeah.
and maybe define hard.
okay, so not colicky, but borderline colic tendencies.
Yeah.
Not sleeping much, crying often.
Hard to soothe.
Yes, but also our
Borderline impossible to soothe sometimes.
yes, but also our first, and so
Yeah.
very hard on our
Is
marriage.
this how this is?
Yeah.
Is this what having a baby's
Why
like?
does anybody have more than one?
Yeah.
Yeah, exactly. So it took a while.
That's tough.
Yeah.
That's a hard way to start.
Yeah,
Yeah. And it was a year before he slept through the night for the first time.
yeah, just all kind of all the things. I also though, knowing now he's got some oral sensory things, and so breastfeeding was hard, and I exclusively pumped.
Oh, sure.
And I'm glad I was able to do that for him.
hard.
But I don't ever want to do that again.
Right. That's hard.
Yeah, it was very hard, and so that kind of added to all of that too.
So some years go by, 4.5 exactly.
Yeah,
And then this conversation comes up again.
yeah. I actually say like, "Do you want another one?" He says yes, and then I find out later he was half joking, and by that point it was too late.
Yeah,
And so-
maybe that's a takeaway for you, Dad. Don't joke about these
Yeah,
things.
yeah. I had learned a lot about how to get pregnant in that time, and we got pregnant on the first try.
Wow.
And so things were still going well.
Did you have any miscarriage fears with this?
This one I did. With our son, I did not. God gave me so much peace with that one, and I did not fear with him at all.
Yeah.
But with this one, I very much struggled with that. And that was hard for me because I felt like I didn't have that in the one prior. And so for that to all come back up was hard for me to deal with.
And when did we meet you in this process?
So I had started seeing the doctor that I had with our son in our hometown. And
And COVID was very much still a thing.
yeah, we were about a year out. It was April of 21.
Oh, boy.
And I just wasn't happy with the way that they were handling a few different things.
They didn't even see you to verify that
Yeah.
you were pregnant the first time.
Yeah.
There was some crazy stuff happening.
Yeah. I had a sinus infection and I had a low grade fever. They told me if it was 99.5 or higher, I wasn't allowed in the office because of high risk patients.
Oh, yes.
And I very much felt like, okay, well, what about me? And so at that point I was like, okay, I want a midwife. Like that was a very foreign thing for me at that point, but I was like, I don't want the traditional system.
Something's wrong. I want something different.
Yes. And there were some other things that had come up that I was just like, okay, I'm done. And so I literally just Googled midwife, Indiana or something. And
We popped up.
you were the first ones. And so I called and I was like, okay, this is where we're going.
Now, I think it's interesting. Why do you think you said, I don't like what I'm doing? Oh, the solution is I'll Google midwife. What did you know that made you think that?
I really don't remember. I think I just wanted something a little more like holistic feeling,
Sure.
something outside of the traditional healthcare system.
Yeah.
Yeah.
And so he was very skeptical at first. And so we scheduled an appointment, just kind of like a come and meet, see how things would go. And by the end of the appointment, he was on board.
Yeah.
Okay.
So I think I was 11 weeks because I remember they said, well, we can try to hear the heartbeat. And they could hear the heartbeat and they thought, you might even be a little farther along than what you think because we're hearing it so strongly. And so that's kind of how we ended up here.
That's interesting. I mean, the way people choose their providers is probably a whole episode or 10 on its own.
Yes.
But I think more times than not, it's just sort of accidental gut feeling.
Yeah.
And then I think it's so important. It's like dating. There's a chemistry or there's not a chemistry.
Yeah.
And if
Yeah.
there's not, there's not.
Yeah.
And we are going to do a series of episodes on how do you even think about choosing providers?
Yeah.
Not which provider to choose, but how do you go about choosing?
Yeah.
But I think a lot boils down to just we talk. Is there something there? Do I get a sense of, do I like this chemistry? Do I like your model of care?
Yeah.
How do you go about the business of providing
Sure.
it? And does it feel right to me? So it must have felt right.
It did. And I mean, until that point, I had never saw myself driving an hour for a doctor, especially when I think about all these prenatal appointments. And then, because eventually you're going once a week.
Yeah.
And so the thought of driving an hour once a week that felt really hard.
Yeah.
But once we came here and I realized this is where I want to be, it felt worth it.
Wow. Well, that's flattering. So you're here, you get established, and then you make a decision about place of birth at some point in that journey.
Yeah.
Let's talk about that.
I mean, the thought of being in a birth center was still very foreign, but the more I was here and seeing the way that you care for patients, the more I thought I can see myself having this baby at the birth center. I loved the idea of our son being able to come in, getting to meet, having that time as a family of 4 in the suite, and then we get to go home. Like, we don't have to stay at the hospital. Like, we get to go home and be our family.
It's funny. We always say in our birth center seminar, the first time parents say, I have to go home. The second time parents say, I get to go home.
Yeah.
Because they've lived through what it's like on the hospital side after you deliver of just wanting to go home.
Yeah.
Now, when she started telling you, Joel, about this birth center idea, do you remember what you thought?
I mean, I would say I'm the consummate skeptic. So
It's called husband. That's what we do.
So I'm very skeptical, but I'm like, okay, look, I'm okay with.
Yeah.
We can go meet. That's fine.
Yeah.
And
We'll see what
then I can say no, right?
Sometimes we call the birth center the husband option because sometimes the wife will say, I want to have the baby at home. And for whatever reason, we husbands will say, oh, no, I can't even conceive of that. And then the wife will say, how about the birth center? And for whatever reason, that seems less, maybe it's just a compromise position.
Yeah.
I mean, I like to think of the birth center as a home birth at somebody else's house. Maybe a lake house that you borrowed or something from somebody. So she convinced you at least to take a look.
Yes.
So you chose the practice, and then after that decision, you chose birth center as an option.
Yeah.
Was that a stretch? Were you intimidated by the idea of A, not being in a hospital, and B, not being able to use epidural or something like that?
I didn't have an epidural with our son. I didn't really have a desire. When I was 13, I had surgery for scoliosis. And so I have a lot of hardware, including a rod on each side of my spine, the whole length of my spine.
Yeah.
And so when we had our son, the anesthesiologist said, or they told me it would kind of, if the anesthesiologist was willing and able for the epidural. But I really just didn't have that desire.
So that part wasn't difficult.
No, it really wasn't. I think knowing that there was different options in the birth suite of, the water, the shower, the bed, I felt like I never really landed. I was like, we'll just kind of see how it plays out. We'll see what feels comfortable in the moment. That was kind of what I had decided on.
In fairness, is that how she gets through life? Is she just take it as it comes?
No.
Okay.
No.
Hence your struggle to answer. So that's not your approach.
No, it's not.
Wow, that's interesting. But for whatever reason, it was for this.
Yeah, I think because it was just so new. And even though I'd had a baby, I knew this probably one would be different in some ways. Yeah. So I was just thought, we'll just see what feels comfortable in the moment.
All right. So you choose here, you choose the birth center, and now you're on a path.
Yeah.
The prenatal care path, which is not that different.
Right.
And then keep walking through this story.
Everything is really great until I think it was 37 weeks. It was my last day of work at the school before we went on Christmas break. And he was actually homesick, and our son wasn't feeling great at school. He was in my class that year. And so I texted him, and I was like, just come pick him up. He can go home and rest with you. And so I came to this appointment by myself.
Yeah, I forgot.
It was the only appointment I'd ever been to by myself. And they're checking my blood pressure, and it's not great. And so they have me rest, and they check it again, and it's still not great. And it's a Friday. So they send me home with the paper to keep track of over the weekend. And
that had to remind you of the last of your
first pregnancy. It did. But I think knowing that I made it through and went into labor on my own, I wasn't overly fearful. I was still very anxious.
Yeah.
And I think partly just because there felt like there was more riding on it this time, because if the blood pressure goes too high, I can't stay at the birth center.
Right.
And so I think that was definitely adding to some anxiety there. Mm-hmm.
Sure.
But so I'm checking my blood pressure over the weekend, and I'm not being a good patient, and I'm not writing down all of the right numbers because
shocking. This never happens.
Right, because I don't want this to be true. So we had to come back.
I didn't know that.
And so we had to come back Monday for a follow-up, and things were still not good. And so right there on the spot, they said, we're diagnosing you with gestational hypertension and you're now going to be transferred to the hospital. We will call you with a date and a time to be induced.
Yeah.
And it was all very fast, very fast. And so,
Yeah, so to
That was
review,
Monday, right?
yeah.
for viewers, gestational hypertension means the blood pressure is elevated, consistently elevated.
Yes.
It doesn't yet mean preeclampsia. Preeclampsia comes
Yeah.
after gestational hypertension, typically. But it does mean that you can deliver at the birth center.
Yeah.
And the reason you can't deliver at the birth center at that point is because you need to deliver. It doesn't need to be the spontaneous onset.
Yeah.
If you'd gone into labor that afternoon, naturally that would have been one thing. But now you need to take charge and end the pregnancy as close to 37 as you can.
Yeah.
So that made the birth center sort of off limits.
Yeah.
Help viewers understand what that was like.
That was so hard. I mean, in a moment, everything I'd been planning for the last 7 months was gone. And we didn't have time to process. And I'm the kind of person I need time to process, and there just wasn't time. We left the appointment, and we were still in Fort Wayne running some errands, and I get a call very quickly with times. And I think there was one or two options. And like the first, I know one of them was the going in on the 21st to start the induction. And I was like, can we wait till after Christmas? And she was like, no. And so that was hard because now I'm thinking, but also like my due date was December 31st. I never wanted a baby that close to Christmas. So now we're even closer to Christmas.
Yeah.
And so again, something else I don't want that's completely out of my control.
Yeah.
And so I had the option of being admitted that night with the Foley
The balloon.
or they could insert it at the office and I could go home. And I was like, I don't want to do that at home. We'll just go to the hospital.
So, that discussion, you're not well.
Yeah.
This is not a simple, easy pregnancy anymore.
Yeah.
And you need to deliver at the hospital. And
Yeah.
we need to do that now.
Yeah.
Do you remember those emotions? I say that because I know a lot of times when I've tried to explain that, it's sort of like the Kubler-Ross stages, right? There's some denial, there's some anger.
Yes.
Do you remember those feelings?
Definitely. I cried a lot. Like, I mean, it took everything in me just to get out of the office without totally breaking down. Just so much disappointment, that everything I had planned was not going to be a thing anymore. And now it's like, okay, now we have to figure out what we're going to do with our son. Because having her at the birth center, having somebody, with him
That was
for a
easy.
few hours, that was fine. But now we're talking about, a couple days, we thought. And so trying to, quickly get everything in order that we need to get in order. And it was very overwhelming.
Yeah.
Yeah, very much so. Because you went from Friday, we have that, the take-home homework.
Yeah.
Monday, they say, okay, this is going to happen. And then
Tuesday night. Yeah.
It's happening.
it's
Yeah.
happening.
Yeah.
Yeah, that's shocking. I know.
Yeah.
We all, providers here, detest that conversation because there's just no easy way to get through it. And we spend so much time together, almost, cheerleading. This is going to be wonderful. You're going to have a Holy Family Birth Center birth. It's going to be like no other. And then I know on the provider side, we feel like we rip the carpet out from under you sometimes.
Yeah.
And it's just hard. I don't know of anybody that copes with that easily. It's hard.
Yeah.
Sure.
Yeah.
But you somehow managed.
Yeah. Yeah.
A few tears, but
Yeah.
you
We did.
managed.
Yeah.
And then so off we go to the hospital for an induction of labor.
Yeah. So we get there at 9:00. The Foley balloons end by 10, which she struggled to get it in. My cervix was curved enough, and so she really had to fight to get it in. So I already don't want to be there. Now this is just very uncomfortable, and it's taking a long time, and just very emotional. Like all the emotions are just right under the surface the whole time. And so we get that in, and by the morning, it's ready to be taken out. And so we're kind of just hanging out. I think they started the Pitocin around that time in the morning. And things are going, but they're going very slow, very slow. And so it seemed like every time they would come in and check, and I'm like, okay, we're going forward, and we're not going forward nearly as much as I thought. And it was just like another disappointment.
Yeah.
And then at one point, they come in to break my water. Well, when I had our son and they broke my water, things progressed very quickly after that.
Yeah.
So that was my experience. So that's what I'm anticipating again. And it didn't happen. And so they break the water, and then we check again, and just more disappointment.
Yikes.
And so then it was probably around 11, 12 o'clock, like the next morning. We'd already been there over 24 hours.
Yeah.
And at this point, I'm already thinking I'm about done. Like
Evening,
yeah.
11, 12. Yeah, it was almost midnight.
Yeah, like I'm ready to tap out. But I'm in my mind, and I never said this to anybody, but in my mind, I'm thinking they won't let me do a C-section if I don't first try an epidural.
Oh my gosh. Wow.
And
You were
so,
that tired.
yeah. And so, because I thought, much as I didn't want the epidural, I thought if I could do that and get some relief, then maybe I could push
Because
through.
you were in a
I was.
lot of pain.
Yes, it was. My contractions were very close together,
Yeah.
even though I really wasn't getting anywhere.
Yeah.
I don't think I got to even 7 centimeters. I know I wasn't fully effaced. And so then we had this conversation of maybe I'll do the epidural. And he was not
at
for
all.
that at all.
Not at all.
You meaning the anesthesia provider?
No,
I
it's
was.
not.
Oh, Joel.
I
Oh.
had friends who had an epidural. His wife had an epidural and
Didn't go well.
didn't go well. She
So was your fear based on Brittany's scoliosis and hardware in the spine, or just epidurals in general?
I think it was all of it combining together.
Oh,
Yeah.
I see. Sure.
Yeah. So I talked him into it, and the anesthesiologist came in, and she seemed very confident that she could do it despite the scoliosis surgery, and she did not succeed.
Oh gosh.
And I was poked multiple times, and she said, there's just too much scar tissue. She said, but why don't I try a spinal? She said, the needle's smaller. So then we tried that, and it still wasn't working. And I said, okay, I'm done. Put me to sleep. I am done.
Now we should probably back up. She was doing that in preparation for the C-section.
No, that hadn't even come out
Not
in the
initially.
room. Yes.
Yeah.
That was just, I need some relief here. These contractions are just too much.
Yeah.
It's been over 24 hours. I can't do this anymore.
Right. So the spinal didn't work.
No.
And then what happened?
And so then I said, I'm done. Put me to sleep.
Do a
And
C-section.
So, yeah, I said, put me to sleep. I'm done. And so he said, okay, we'll call Dr. Stroud. And then it felt like an eternity, but I know it really wasn't that long.
Wasn't.
But, that's worth a pause there to think, really in a matter of what, about 3 days, 4 days, you went from birth center birth to hospital to induction to failed epidural to failed spinal to now I'm having a C-section.
Yeah.
I mean, you couldn't get much further than a birth center birth
Yes.
than a C-section.
Yeah.
That had to take a toll on you.
It did. But I think in that moment, I was so spent that there wasn't anything left for me to even try to process it. I just needed to be out of that moment.
Yeah. Do you remember, Joel, what you were thinking in that moment?
I want to hold my daughter, and I want my wife to not be in so
Stop
pain.
hurting.
Yeah, I'm sitting here and I can't do anything.
Yeah.
I don't want to see her in pain anymore.
And generally, we husband types, we don't like to feel helpless.
Yeah.
We don't like that, especially when our family comes, in perspective. We don't like that. We're supposed to be able to do something. And yet when you can't do something, that's pretty rough.
Yeah.
So we make the decision to do a C-section.
Yeah.
Now, I'll be the first to admit, I don't remember the conversation, but I'll bet you do.
Yeah.
What was that conversation like?
I think I probably told you. I said, I'm done. Put me to sleep. Like that was all that was on my mind. I wanted to be out of that pain.
Because we're at 27 hours at this point or something.
Well,
like
and
that.
I guess I should back up a little bit. They had given me some pain medicine through my IV.
Yeah.
And they told me the first dose would be the strongest, and each dose after that would be less effective. And so by the third dose, I couldn't feel it at all.
So you weren't progressing.
No.
You had terrible pain.
Yeah.
It's time to put this to an end. So
Yeah.
we say we'll do a C-section.
Yeah.
But that was complicated by the fact that you can't do the usual anesthesia
Yes.
for a C-section
Yes.
because of the failed spinal.
Yes.
So then we make the decision to have a general anesthetic,
Yeah.
which means to go to sleep.
Yeah.
Was that frightening at all to think about being put to sleep?
No, that was my 7th surgery.
Yeah. Oh, in your perspective, yeah.
Yeah. So
that's okay.
it wasn't at all.
All right. So off we go to the operating room to be put to sleep, to have a C-section.
Yeah.
Keep going.
Well, and so since it was general anesthesia, he wasn't allowed in the room.
That's right.
And so that was hard.
Awful.
Yeah.
I have no idea what's going on.
Yeah.
Feeling
like they're outside.
Yeah.
Yeah. Literally outside.
Yeah. I feel like I'm a family member in the waiting room, just waiting.
Yeah.
And I think, again, it just adds to he was supposed to be right there beside me
Yeah.
in the birth suite.
Yeah. To be perfectly honest, I don't know why there is the prohibition on husbands being in when there's a general anesthetic. I should know after 30 years, but maybe the reason I don't know is because there's not actually a great reason. I think it's probably tradition, and I think too, frankly, it's rather unsightly.
I'm sure.
To see a loved one who is intubated.
Yes.
And intubation means there's a breathing tube in, and the patient is asleep, and it's not a sightly way to see.
Yeah.
But I still have always questioned why we had such a strict prohibition on that, because of that feeling you're describing.
Yeah.
And then when you don't know, of course, your mind takes off and
Yeah.
thinks of all the worst possible
Yeah.
things. So we're happily doing a routine C-section.
Yeah.
And then what?
Well, I will say one of the things I'm most thankful for is that one of the nurses took my phone and took pictures of our daughter when she was born. Like,
Yeah.
we wouldn't have, like, you could tell they've done that before. Like, that was kind of something that they just do.
Yeah.
And I'm so appreciative of that because I wouldn't have had that otherwise because he wasn't in there and I was completely asleep.
Yeah. There are patients who have actually said if they have to be put to sleep for a C-section, they struggled sometimes to convince themselves it was really their baby. Because if you think about it, they would say, I went into a room, I went to sleep, I woke up in a different room, and somebody handed me a baby.
Yeah.
Yeah.
I didn't see it come out. How, their brain is playing tricks on you.
Yeah.
So the pictures can really help.
Yes. Yes.
And how did the C-section go?
Not good.
It's an understatement of the year.
Yeah.
That was a bit of a slow pitch, wasn't it?
I think
Yeah.
I was in there a long time, but I was asleep. So,
Yeah. So help viewers understand your understanding
Yeah.
of how the C-section went, because your understanding of it
Yes.
and mine are
Yeah.
not going to be the same.
Right.
But what were both of your understandings of
Yeah.
the events that took place during the C-section?
So once I came out, I was pretty much just told that she was stuck and that my uterus tore almost completely off. And so they had to stitch it all back together. And so because I've never had a C-section, I know that my recovery was much more intense because of all of that. However, I will say I think C-sections, because they're so common, I had no idea it was going to be so hard to recover from.
Sure. Yeah.
Like, I mean, it's major surgery. And like I've had major surgery on my back and whatever, but I did not expect the recovery that I was now going to start.
So what do you remember, Joel, about the events that happened during the C-section? Because you heard this all after the fact. What kind of stuff were you hearing?
Well, I'm sitting there holding my daughter. I mean, I can see the hospital area. It's been almost 3 years. And I'm asking, how's Brittany? How's my wife?
Yeah. But you can't see her.
But I can't see her.
Yeah.
And at this point, I think it had been about an hour since she'd gone in there, and then they brought it.
Yeah.
Maybe not quite that long, but it'd been a while. And I could hear, once I could hear her crying, and then they brought her out to me, and I'm sitting there, and they're like, well, she had a tear, and so they're stitching that up, and I'm like, okay, great.
Yeah.
And then Hope and I go to the recovery room, and I had my wife the last time this happened, so I'm asking the nurse because it's been 4.5 years. I don't remember how much they eat. I don't,
Yeah.
So they're helping me with that, and I'm like, how's my wife? And it was about an hour after. I think it was about 1:30 in the morning.
She was born on 27.
Okay, yeah. So I'm holding her, and then about 2:30 in the morning, I think it was about 2:30 in the morning, they brought her out. And then you had come out shortly before that to just say, hey, listen, we stitched her up, and it was a really bad tear, and that she, basically she's gonna be okay. But I think there was a lot of gravity of, and I don't remember if it was in that moment or afterwards that we realized that there was the blood shortage, and she got the last 4 units of her blood type.
Yeah.
Could have lost my wife.
Yeah. Absolutely.
Here I'm holding our daughter. She's perfectly healthy. But I was that close to losing my wife.
Yeah. I think, it has to be that most viewers are imagining right now they can't imagine what that would be like. That weird juxtaposition of, you have this beautiful new baby, this is supposed to be a celebration, and yet I'm thinking, I know something is wrong.
Yeah.
Did you have the feeling that they're not telling me everything, it's worse than they're telling me?
Yeah. Absolutely. Absolutely.
I think family has that a lot.
But I felt like you explained it really. I mean, I felt like you explained it really well, and you were very much just very cognizant of the situation. You weren't cold about it, and that I appreciated that, because I felt like we were being cared for.
There was a blood shortage. I mean, this was in the pandemic, and that was one of the many challenges of the pandemic was blood and blood products. But you did get blood.
Yeah.
I guess we should say for viewers, we've used the word tear several times. We know what that means, but when you do a C-section, you make an incision in the uterus, and then you remove the baby through that incision, and then sew that incision back up again. But often that incision extends to being larger than the one that you made, which usually is a good thing, but it can get out of control as yours did.
Yeah.
And it can result in the need to do a hysterectomy on the spot,
Yeah.
which is really horrible. And I think you had some thoughts like that.
Yeah. So once I was in my room and I'm starting to realize how bad things really were during the C-section, I think I had just woken up, and he was sitting beside me, and he looked at me, he said, "You're so strong. I thought I was going to lose you." And that's kind of when it started to sink in a little bit. And when I heard that my uterus had tore, almost to the point of a hysterectomy, there was a part of me that thought, I wish they would have just done the hysterectomy, because I don't ever want to do this again.
Oh, right.
But even in that moment, I knew the 29-year-old Brittany really didn't want a hysterectomy, but there was just so much emotion and so much fear that I thought, I don't ever want there to be a chance that I have to do this again. This was terrible.
Yeah. Did you have any of those detachment feelings that I mentioned about, did I really give birth to this child? Is it really mine?
Not really so much. Despite all of the trauma, I don't feel like I struggled to connect with her. I know that can be a common thing,
Right.
but that was not something that I struggled with so much.
So we, the three of us, get through this.
Yeah.
We get through this acute moment.
Yeah.
You get the blood that you needed,
Yeah.
and we don't have to do a hysterectomy by
Yeah.
grace. And what happens after that?
So we're in the hospital and very, very slowly recovering, it feels like.
Very slowly.
I received 4 units of blood plus plasma. And I was told later that at one point I had an IV in both hands and both feet. And I received the blood transfusion through my foot. And I had several nurses, "That's the most painful place." And I'm like, I was asleep. And so it's Christmas Eve, about the timeline for the hospital to be released, and I want to go home. I want to be home Christmas Day to open gifts with our son. I just want to be home. This was not how things were supposed to go.
Yeah.
And we're all set to go. At least we thought. Like, Marianne had come in to check on me that morning, and she said, "How are you doing?" And I said, "I want to go home." And she was like, "Okay." And so a midwife came in later and took out the drain tube, which was horrific. I will never forget that feeling.
I don't remember that.
And so, like, halfway through the day, probably sometime in the afternoon, we're telling the nurse, like, "Hey, like, when are we getting discharged?" And she says, "Oh, the baby's jaundice levels are elevated. She's not getting discharged." And again, more disappointment. Nobody had said anything to us about that.
Yeah.
This was brand new. We didn't know anything about this.
Right.
And so, again, just more devastation. Okay, I'm not going to be home Christmas morning. Like, more plans just gone. And so kind of trying to gravel that and be okay with it, because there's nothing I can do about it.
Right.
And so at that point, it wasn't the first time one of the nurses had asked me, but it was that same nurse asked me, "Are you ready to start pumping?" And every time I would say no. And I knew that breastfeeding was going to be more painful because this was my second one. And I had been in so much pain. I was still in so much pain. I didn't think I could handle any more pain. I was maxed, beyond maxed. And I knew that was going to be painful, at least for that moment, until we got established. And she was so sensitive to that, because I was very emotional. And she said, "You feel like you're a bad mom because you don't want this." And I said, "Yes." And I didn't end up breastfeeding her at all
Yeah.
because it felt like too much. The recovery from the surgery was already so much. The thought of trying to breastfeed was too much. Like we even took a class here because it had been 4.5 years and I exclusively pumped with our son. So this was kind of a new thing for us, even though it wasn't our first kid. Like I was very much fully prepared to do this
Yeah.
and it just felt too overwhelming.
Wow.
And I really struggled with that for a while.
But you managed to get out of that place
Yeah.
with
Yeah.
your daughter.
Yeah. So
it-
Christmas Day, Marianne comes back to see us.
Midday.
No, it was
Well,
first thing in the
Oh,
morning.
right, yeah.
And she said, "You look much better today." And so I think it was probably best that we did stay that extra day as much as I did not want to. I think it was best that we did stay. And so we went home.
Midday.
Yeah, we were finally discharged and went home with our daughter midday Christmas Day.
You know, as you think through those, especially after the surgery, and you referenced to nurse being helpful, what would you say to healthcare workers that might be listening? You know, what was the best thing that was done? Where were the healthcare providers at their best?
I can speak to that because I watched every person from the nurses to the doctors to the cleaning staff to the people who brought our food be so empathetic and so genuine. They weren't just doing a job; they had passion to help and care.
Yeah. Yeah, emphasis on
and-
care. Yeah.
Yes. And it was, I saw that everybody took that charge. And I think that was the only thing that got us through is everybody, we've been through this traumatic thing and everybody was so caring.
Yeah. And it's interesting, I'll bet if we could find those people, they wouldn't necessarily think what they did was particularly caring, which is probably part of the magic of it.
Yeah.
But I also think, and maybe this is a lesson for people earlier in their careers, whether it's nurses or others, that we shouldn't take for granted those little things.
Yeah.
Sometimes just a touch, just a kind word,
Yeah.
just expressing empathy.
Yeah.
Yeah.
And you can't take a class in that.
No.
Yeah.
We're also sitting here and we had the birth center birth paid for.
Yeah.
And we're going, how much is this going to cost? We've been here
Yeah. Days.
4 days by the time we left.
Right.
We're on a healthcare sharing plan. How's this going to work?
This is how we dads think.
Yeah.
And and that's where the care too. I don't remember if it was a lady that was cleaning or one of the ladies who brought food, but she brought us some extra meal tickets that we weren't supposed to have.
Wow.
Just
Little things.
so small,
Yeah.
and it meant so much.
That's amazing. Yeah, I hope this is a reminder to any of those people that might be listening, that because it would be easy to think that doesn't matter.
Yeah.
That to just get lost in the grind of the job.
Yeah.
But I think the thing that when I've been a patient, I had similar experiences to you. It was those little things,
Yeah.
an expression, a touch,
Yeah.
just a sense of, wow, this person is actually interested
Yeah.
and caring.
Yeah.
Yeah.
Were there areas in that experience, can't avoid asking, I guess, where we could have been better, where the healthcare system could have done better?
The billing department.
Oh, my.
Yeah. There's no hesitation with that one.
No.
We had a great experience there, and when we got home, it was a total 180.
Oh, yeah. That is the ugly side of the whole thing.
Yeah.
It was rough to
Yeah.
say the least.
Yeah. Yeah.
And do you feel like it was because you were using a sharing plan? And
That was a lot
I
of
think
it.
it was
Yeah.
a lot of it. Yeah.
Yeah.
It's less new now, 3 years later,
Yeah.
but it's still relatively new.
Yeah.
And it can create a lot of confusion.
Yeah. I think part of it, though, for us is that we got the bill on the 31st. It was a holiday. It was a Friday afternoon, and it was due Monday.
Oh, my.
Yeah. And our bank is closed Monday.
Right.
And I mean, it was $95,000.
It didn't really matter if the bank was closed or
Good.
not. did
No,
it?
said,
yeah,
yeah.
but there was
But-
nothing for him to go and talk
Not
to on
talk
Monday to try
anybody.
to get it.
It said $95,000, or if you paid by Monday, it was 19.
Yeah.
Yeah.
Like, still $19,000.
Yeah.
Yeah, but not
Friday to Monday.
Yeah.
What? How can I pay by Monday if
I mean, he looked like he saw a ghost when he opened that bill.
Yeah.
And then we might as well continue. What
Yeah.
happened with all of that? I know people want to know.
Yeah.
I was Monday. I was working I have a lot of landscape business, but during the winter I was helping out a company that I worked for before doing IT work. Totally opposite sides of spectrums, I know. And which that in and of itself, I had always had some temporary jobs during the winter, but none of them were super consistent. And it was a blessing that I had that job that was consistent, because she's now off for 12 weeks,
12 weeks, yeah.
not bringing in income there. And, my normal income is during the summer. And,
Yeah.
We'd had some money saved, but, $19,000 is a lot of money.
Yeah.
And I called Monday. I was on the phone for what seemed like an eternity. I mean, I remember crying. I was sitting in someone else's office working on their computer with the door closed, crying, talking on the phone to the billing department. And that was where there was no empathy. This is a job.
Yeah.
This is what I need to do.
That's too bad.
This is the way it is. Basically, without hanging up in a sense. This end of the conversation. You pay today. We'll give you an extension till tomorrow,
Wow.
Tuesday. Okay. So I call healthcare sharing, try to work out. And, for me, I see how the bills affect the healthcare sharing. So if we can do 19,000 instead of 95, if everybody does that,
You're being a good steward.
Yes.
Yeah.
and and I'm thinking, do I sell my truck?
Yeah.
Do I sell my mower? Do I sell all my equipment? I'm talking to my parents and just like, do I just sell all this stuff so that we can, and I ended up, we had a decent amount of cash, but it wasn't 19,000. But after talking to the healthcare sharing, they're like, well, there was after a certain amount, we kick back in, which I didn't know, which was okay. That's relieving. And
Because we'd already used our portion from them for the birth center.
right,
Sure.
right. And then, so of course, I'm on the phone with him for an hour, and he was amazing. Every time I've called, they've been amazing. Nothing short. I mean, just empathetic and caring, and that's the things you want when you call when you have a problem. And I'm talking to him, and I'm telling him I would like to have I would like to do the 19,000, so that this doesn't all come back on. And they're like, well, if you can, they had talked to their supervisor, and like, if you can do that and figure out a way to kind of scrape that together, we can kind of get you funds really quick, because normally it's a 6-week process before you start seeing that reimbursement, essentially.
To be clear, for those who may not be accustomed to the sharing, in general, the sharing products are all a little different, but the patient pays, and then the sharing product pays you back and reimburses you. But there can be a delay.
It's a delay,
Yeah.
yes.
So which means you're floating in some cases
Yes.
a lot of
Yes,
money.
and so we drained our bank account, and then knowing that we had a good portion coming. I don't remember how much it was at this point, which is surprising because I remember all the numbers. But we don't use our credit cards. We believe in paying cash and paying for things. But I had 2 cards, and we maxed them out because I knew that was coming.
Yeah.
Because they told us that was coming, and it all worked out.
Yeah.
A couple weeks later, we had that, paid off the cards, and moved on. But after talking to the billing department for hours, I wasn't getting anywhere.
You made phone calls for weeks.
It was about 3 weeks every day I was on the phone.
Wow.
Because that 95 was just the first bill.
Correct.
There was more that came after
Yes.
that.
Sure,
Yes.
sure. Wow.
Yes.
Yeah, it's sad that is as traumatic, maybe
Yeah.
more traumatic.
Yeah, and that
Yes.
Medical events.
absolutely, and that was we just had this traumatic birth, and now you're making it worse.
Yeah.
Wow.
Yeah. I mean, he's caring for me, he's caring for our newborn daughter and our son, and he's working, and now he's dealing with all of this.
And you're trying to avoid bankruptcy.
Yeah.
Wow. That's amazing. But again, you guys persevered.
Yeah, we did.
So what was next? What was the next phase?
I think coming home was I mean, we'd come home with a newborn before, so that part wasn't so hard.
Sure.
But we hadn't come home with a newborn where I was not able to really do anything.
Right.
I couldn't get out of bed by myself. I couldn't get out of a chair by myself.
Go to the bathroom by yourself.
Yeah.
And so that was definitely an adjustment, especially then when you add everything else and he's doing it all.
Yeah.
And so that
I'm not a cook.
no. Thankfully
She's a
my mom
cook.
thankfully my mom came over a lot. I mean, I think she came over every day for a month after we had her, and that was huge.
It was. It was.
But as we came home, despite how tired I am from this surgery and having a newborn, I did not want to lay down and close my eyes because every time I did, all the events just replayed over and over, and they would keep me awake.
Wow.
And so that was hard. Thankfully, that did not last super long. I would say maybe a week, and then it slowly started to fade. But then Marianne gave us the instructions on how to take the bandage off. And
From your C-section.
yes, from the C-section, yes.
Oh, yeah. I forgot about that.
And so I waited a little longer than what she told me. I'm very much a rule follower. And so, but I waited a little bit longer, but it wasn't anywhere near the 6 weeks because she told me some women will come in at 6 weeks and it's still on and it smells terrible and all these things. And so it was nowhere near that. But I think it'd been about a week. And I had taken a shower and I knew, and they warned me this at the hospital, but I've had prior experience from my back surgery. You don't take a hot shower with a fresh incision. And so my shower was not hot. It was warm. I was very safe with that. But I got out of the shower and I thought, I'm wet, it's loose, I'll go ahead and take this off. And I took it off and the air hit it and I passed out.
Oh, gosh.
And so his parents and brother and sister-in-law were on their way down from Michigan for Christmas that we had pushed back because we had this surgery. And I'm yelling at him and he comes in and I'm laying on the bathroom floor.
Oh,
And so he carries me to bed and I rest. And that was just like the main part. There was still that pad on the top part. And so I waited a few more days and I had my mom, I lay on my bed on my back with my knees bent, all the precautions, and she takes it off, tells me how terrible it smells and throws it away.
oh my. More trauma.
Yeah, but I think part of it, I was not eating very much. I just didn't have the appetite still.
Yeah.
I couldn't even finish a whole bowl of Easy Mac. Like my appetite was very low.
Yeah.
And I think I wasn't getting enough food, enough nutrients, and that probably played a role in passing out also.
Sure.
But it very much felt like we were going backwards at that point. Slowly getting better, and now here I am passed out on the bathroom floor.
Yeah.
More disappointment.
Which
Yes.
is
More setback.
Which
Yes.
is, the second time
Yes.
that she's been passed out on the bathroom floor because with the miscarriage,
Oh,
Yes.
which was, for me, brings all that back.
Yes. I had sent him, I said, I can't get out. Like, I had miscarried at home. I went to the ER. They said, you're having a miscarriage and sent us home.
right.
And so I go home. It wasn't very long after we got home. I miscarried. I go into the bathroom and I say, you're going to have to go to the store. I need thicker pads. I can't get off this toilet.
Yeah.
And so he goes to the store and he's not gone more than 5 or 10 minutes.
I know, it was like 2 minutes.
And I'm like,
was
I'm
barely
gonna
down the road.
pass out. And I call him. I said, you need to call an ambulance. I'm gonna pass out.
Oh, my.
And when he got home, I was passed out.
Yeah.
So that, yeah,
That
I
seems
didn't
like
even
any
think
husband
about
ever
all of
wants to
that.
see.
Yeah, no,
Wow.
Yeah.
So what a traumatic journey.
yeah,
How long do you think it took you, if you have,
yeah.
to sort of process and get over that?
Well, so I went to my 6-week postpartum, kind of still needing some answers. I felt like I still didn't really know what had happened.
Yeah.
But the chart only said so much, and so the midwife suggested setting up an appointment with you, and so that's what we did. It was 4 weeks after that, and that was very helpful for me.
Yeah.
And I remember you asking me point blank in your office, "Do you think you have PTSD?"
Oh,
And I said
sure.
yes, and you said good, because if you had said no, I would have said you were lying. And like, even though I wasn't doubting it, it was still very validating to hear that.
Sure.
And so we talked through some of those things about the struggle of being asleep when you're having a baby and not being able to experience it in the same way that you do,
Yeah.
a natural or even just a vaginal birth. And so that was very helpful. But during that time, during that appointment, you had also suggested that maybe I should see the counselor that was at the birth center.
Sure.
And so we also set up something to start physical therapy
Yeah.
because I had a lot of pain for my C-section. Just very sensitive. I couldn't wear clothes over it. It was just too painful. And so,
You make an important point because I think too often in sort of the specialty, care is sort of over when you leave the hospital.
yeah,
And that's probably not optimal, but okay in a lot of cases.
yeah,
But in cases like yours,
Yeah.
you weren't finished.
no,
And especially if there's been a trauma.
Yeah.
And the trauma doesn't have to be as horrific as
right,
yours.
yes,
It could just be an experience that wasn't anticipated. That can be traumatic.
yes,
And we as providers, if there's other providers listening, we need to make a space for that
Yeah.
and to do what we did and kind of process after the fact.
Yeah.
What do you remember?
Yeah.
Because I've certainly seen through the years that you know the brain does funny things and you misprocess
Yeah.
and you think someone said something
Yeah.
that they didn't actually say
Yeah.
or that they did say and you don't remember that. And there needs to be a time when it's still fresh in everybody's head to kind of get through that.
yeah,
It's busy, everybody has a lot going on, but that can be critical to do.
yeah,
Yeah.
yeah. And so I ended up setting up an appointment with the counselor. She fit me in right before I was going back to work from maternity leave because I was pretty much a mess. I was very anxious and like I thought I don't know how I'm going to go back to work. I was still dealing with some triggers. I'm a teacher's aide in a preschool classroom, so like I need to be on. I don't have the space or the flexibility to just step out for a few minutes to compose myself because that's not a thing in the preschool world. And so I came in and I had an appointment with her, and the first thing she said was, "We don't have to talk about what happened, and we may never talk about what happened." And so she kind of gave me some coping things and some breathing things that helped, and I implemented those when I went back to work. But now 2.5 years later, I still see her once a month. And that, I think, has been one of the best things that has come out of this for me.
Wow.
It's been so life-giving for me. And because, like, one of the things that for me, I feel like has been so important is that I've learned from her is that even though I was asleep for so much of that, my body still experienced that. And there's still trauma there.
Yeah.
The body stores trauma. And so for, like, our daughter's first birthday, I ended up pushing out her party 2 weeks just because I felt like I needed that time and space to be able to process all of the trauma and the memories that I was anticipating to resurface at, her first birthday.
Yeah.
And I think that was one of the best things I did.
I know she wouldn't mind me saying so, but you're talking about Amber Todd.
Yes.
She's been on this show.
Yes.
We've done several episodes. We'll do many more, I hope. But ironically, sort of, she's a trauma specialist. That's
Yeah.
really a big part of her background.
Yeah.
And I know she has taught us a lot about trauma, but
Yeah.
all of those things that you said are just so important.
Yes.
That trauma is its own thing.
Yes.
Sure, it's sometimes easy to get over the medical part,
Yeah.
but
Yeah.
what's left, those
Yes.
scars can be really tough.
Yes. And so really it's just been earlier this year that I really kind of told her the whole story. But even then, we've still not spent time really unpacking everything that has happened.
Yeah.
And so even kind of thinking about what I would share today got me emotional. So I would say maybe in some ways it's still a very emotional experience for me. So it's definitely not what it was. I can look at my scar and not feel triggered anymore. But that was very hard for a while.
I'll bet.
And I'm sure some of that is just because it has faded now that, I'm 2.5 years out. But it just doesn't bring all those memories back like it did in the beginning.
I'll bet if there are healthcare providers, particularly obstetricians like me, listening to your story, they would be surprised to learn that they have examples of you in their practice as well that they don't know
Yeah, yeah,
about. Because if you don't ask, you will not
Yeah.
find out.
Yeah.
And if you don't create that space to sort of process those feelings,
Yeah.
you'll never hear about it.
yeah,
Because the patient usually goes away.
yeah.
They don't
Well,
come
if
back.
you hadn't have suggested these things, if it hadn't been suggested that we meet with you, if it hadn't been suggested I go to physical therapy and to counseling, I would not have done that. I wasn't in the space
Yeah.
to put myself into those places on my own at that point in time. But those were some of the best things that came out of all of this for me.
Yeah. So I know people are wondering, and so I'll ask for them.
Yeah.
What happens next in your married life?
I think this is it. He turned 40 yesterday. So
So you're
Hey,
young.
hey.
You're very
That's
young.
okay.
Everybody thought I was 30.
it's okay. So I think we're pretty done.
Do you think this traumatic birth influenced that decision, or do you think that's just an organic decision that
I think we kind of were already at that point. I think especially because, for a while it seemed like maybe we weren't even going to have this baby. And so very much feels like where we're at. This is kind of the max is what we can handle.
Yeah.
I think I would really have to stop and think, like, would I want to do this again? Because I think I already knew going into this was going to be it anyway.
Yeah.
But I think, because like when we had talked, I'd asked you, I said, like, could I, well, one, I asked you, I said, could I have even pushed her out? And you said no.
Yeah.
And so, well, I guess maybe you don't remember this, but you had told me you had tried to pull her and she was stuck. And so you pulled a little bit harder and she still wouldn't come. And so a third time,
she was small.
she was 6'3". And so a third time you pulled even harder and she still didn't come. And so you had the nurse push from up
From below.
and you pulled.
Yeah.
And so you had told us that sometimes those smaller babies can turn into positions that make it harder to get out, and which makes sense, but I would have never thought of that.
Yeah.
But I had asked, could I push her out? You said no. And I said, well, can I even could I even carry a baby again? And you said yes, but it would be a C-section at 37 weeks.
Right.
So the thought, knowing with the hope, I guess, that I would not have all of the extra trauma and, tears, it would just be a normal C-section. That feels like it'd probably be really easy compared to what I went through.
Yeah.
But I still don't know if I'm ready to sign that off.
Yeah.
So,
Well, it's interesting. Your story could have been so much different in a lot of ways. The story
Yes.
could have changed, but it's not much of a stretch to imagine that you had to have a hysterectomy.
yeah.
And I've had to do that, unfortunately, several times. And that conversation afterwards is really tough.
Yeah.
Because then you've gone from, I went to sleep, you gave me a baby, and now you're telling me I don't have a uterus anymore. And the trauma from that can just be horrific.
Yeah.
Better than telling a husband that he doesn't have a wife anymore.
Yeah.
But to lose, it's one thing to not choose to have more
Yes,
children.
yes.
It's another thing to have that biologically taken away from
Yes.
you. So I'm thankful that
Yes,
that wasn't
I am
part of your
too.
story.
Yeah.
I happen to know that you're a person who relies on faith.
Yeah.
Help viewers understand, where was your faith in all of this, and what impact did it have on you?
I would say, especially while we were in the hospital, like in labor, and there was just disappointment after disappointment, I very much felt like I was like, God, where are you?
Yeah.
It was very hard. And so actually, once I got home and I was doing, all the middle of the night feedings and things, I did a Bible study on my app through the book of Job, and it was about why.
Seems appropriate.
Yes, and it was very helpful. And so kind of slowly worked my way back through, like, I don't understand why this happened, but God, I'm going to trust you anyway. And so I don't know that I would have ever gotten connected with Amber had this not happened. And so I am so grateful that I'm able to have that space with her. And I probably would have never met Nicole and gone to physical therapy with her. And because not only did she help the C-section, she helped my scar on my back. She gave me exercises of things I can do at home to help when I have back pain and strengthen my core and things that I've always wanted, but just didn't feel like a priority necessarily. And so it was just like, I'll just deal with it.
Yeah.
And so even though it has been very hard, like, I can see how God brought good things out of that situation for us.
Yeah, he always does.
Yeah. Yeah.
And then, lastly, I guess, how about your marriage? I've seen in my 30 years, strong relationships really began to fracture over medical trauma and unexpected, I should say, complications. How or has it affected you guys?
I think it's one of many things on a line that has made things really tough.
Yeah. Yeah.
Over the last, and we were going through a bunch of them the other night.
Yeah.
There was a lot of things that
Yeah.
made it really tough. I don't know if you want to talk to that more.
Yeah, it definitely was hard. I think that's one thing people don't talk about is how hard parenting is on a marriage.
Oh, yeah.
I think that was a big shocker when we had
If
our
everything
son.
goes perfectly. It's,
Yes.
Yeah.
Yes.
You throw a few curveballs, it's really hard.
Yes. But I think now that, our daughter's 2.5 years old, I think we're finally getting to the place where things are getting better and we're on the up.
Yeah.
Yeah.
But I like the way that you said it. You just summarized and said it's hard,
Yeah.
because that pretty much says it all.
Yeah.
I've been married a long time, and I talk to married people for a living, and it sort of feels like there's two sorts of couples: those who acknowledge that it's hard, and those who pretend that it isn't.
Yeah. Yeah.
But it is hard.
Yeah.
And I don't know about you, but I would say at the same time, it would be impossible without the marriage to try to endure these things.
Oh,
Yes.
absolutely.
Yes.
Even though the marriage could be hard without
Yes.
it, I think we would just, crumble.
Yes.
Well, it's amazing that you had the courage to tell this story. I'm glad that you survived this story.
Yes.
I'm glad that I had a chance to play a part of it.
Yes.
And thanks for your witness. Thanks for your courage. If you were going to advise, couples listening at this point, what would you share with them?
I think one thing is like have a plan B.
Yeah.
I normally am
Maybe
that
C
kind
and
of
D.
person. Yes. And that is my personality. But I think
There was only a plan A.
there was only a plan A because I think I didn't want to think about an alternative.
Right.
And so I think that would have helped me at least to have processed a little bit more in those moments if I had thought maybe this would happen.
Sure.
But like I just remember thinking the whole time, like we'd go to the classes about, this is what happens with a transfer. And I thought, oh, that happens to other people, not me. But it happened to me.
Yeah. Well, I hope you've enjoyed this episode of All Things Women's Health as much as we've enjoyed bringing it to you. I hope that you've gained some insight and some sense of confidence in the possibilities of listening to Joel and Brittany talk about their journey. Painful, of course, but the triumph and their ability to overcome the adversity. I hope that you found that as inspiring as I did. Do you have a story that you'd like to tell on our show? We'd love to hear from you. You can reach me at Dr. Stroud at fertilityandmidwifery.com. You could message me directly if you like, 260-450-8878. I'd love to hear from you. What do you think of this show? Are there other topics that you would like to hear us bring forward? I'd like to hear all of that and more. So thanks again for joining us on All Things Women's Health. Please like, subscribe, and share this with everyone that you know. I'll be back again soon with another episode of All Things Women's Health.